Could you imagine one of your loved ones getting a disease that cannot be treated? Well, according to the World Health Organization website, a directing and coordinating authority for health within the United Nations system in 2014 said, there is as yet no proven treatment available for EBD. EBD stands for Ebola viral disease. So today, I want to help everybody understand what is Ebola, how Ebola virus spreads, what precautions to take, the severity, and what is being done today. Ebola first appeared in Sudan and the Democratic Republic of Congo in 1976. It then spread to the Ebola River. That's how Ebola got its name. Now the main question here today is, what is Ebola? Ebola is a viral illness with the beginning symptoms of sudden fever, intense weakness, muscle pain, and a sore throat. Other symptoms include vomiting, diarrhea, and even internal and external bleeding. Ebola affects humans through the close contact with infected animals, which include chimpanzees and fruit bats. Even at funerals, people are at risk of getting Ebola if they have direct contact with a dead body. Now, how does the Ebola virus spread? The Ebola virus attacks a cell. The virus genetic contents are released into the cell. This genetic material takes over the cell and makes copies of itself. The new copies of the virus are produced and released back into the system. According to BBC News website, last update October 8, 2014 said, the current outbreak is killing between 50 and 60% of people infected. The death toll for Ebola in 2014 was 9,652. The death toll for the swine flu in 2009 was 203,000. The swine flu was a virus that attacks the respiratory system in pigs and humans. The death toll for the Black Plague in the 1340s was 75 million. The Black Plague is a disease that attacks the respiratory system and the circulatory system in humans. As years progressed, advances in the medical field and technology has helped drastically. According to Betsy Anderson, a senior producer for CNN in November 2014 said, Africa is facing the worst Ebola outbreak in history, and its arrival in America has prompted many people to finally take notice of the deadly disease. America has created an organization called AmeriCares. AmeriCares provides antibiotics, medical supplies, and safety equipment which include masks and gloves. UNICEF, which stands for United Nations Child's Funds. United Nations Child's Funds has helped at least 5.5 million people in West Africa. They send 550 tons of supplies, which include hygiene items, medical supplies, and protective equipment. The International Federation of Red Cross and Red Crescent has helped dispose dead bodies and provide emotional support for all of the people that have been affected by this disease. Doctors Without Borders is an organization that has 6 Ebola centers in Africa. They provide hospital beds and 2,000 hired staff. What to wear? Surgical cap, goggles, scrubs, double gloves, boots, apron, overalls, respiratory mask, and a medical mask. Volunteers need to go online and fill out a form. Here are some of the precautions that need to be taken. You need to stay away from these infected animals. If for some reason you need to be in contact with these animals, you need to wear the protective equipment. The animals were fruit bats and chimpanzees. Also, do not have direct contact with people with Ebola symptoms. Again, if you need to be in contact with these people, make sure that you wear the protective equipment, especially at funerals. Still to this day, Ebola Ebola is killing hundreds of innocent lives, and it's unsure when the disease will be completely destroyed. So today, I hope I helped everybody understand what is Ebola, how Ebola virus spreads, what precautions to take, the severity, and what is being done today. Woo! Does anybody have any questions?
Who is at risk during the outbreak?
The people that are at risk during the outbreak is usually the people that are around the Ebola patients, the health workers, and family members. Any other questions? Yes?
Can Ebola be contracted through infected water and foods?
No. Ebola is not a water-borne illness or a food-borne illness.
Thank you.
You're welcome. Any other questions? Okay, thank you.